Hi, it's Dr. Keith McAfee. Welcome to Medicine and Faith, where I take a subject of medicine, teach about that, and then relate that to our faith. Today, we're going to talk about high blood pressure, or the other designation is hypertension. We abbreviate, for the sake of time, hypertension, high blood pressure. Let me explain basically what hypertension is, and it's fairly simple when you think about it, when you reduce it down. So here's a blood vessel wall. Okay, now I've taken an artery, cut it, and I'm looking at it from one end. And it's thick-walled. Arteries actually have very thick walls. Veins are very flimsy, very thin walls. But arteries are thick-walled. And the reason they're thick-walled, this, by the way, is where the blood is. So that's blood. The reason it's thick-walled is because there's a layer in it of muscle. And actually the muscle is the majority of the wall. It's very thick muscle. I'm not trying to pretend this is exactly to scale. This is just schematics. But here, pretend the green is your muscle, okay? And there's a lot of it in the artery walls. Now, those muscles in the walls of the artery are always a little bit tense. Not much, just a little bit. I call it relaxed tension. But if you took all of your blood vessels, veins, arteries, and relaxed them completely, at the same time, all completely dilated and relaxed, your blood would probably drop down here somewhere. We don't have enough blood in your system to fill your entire body. That's because we don't need it, because the arteries are always just a little gently tight, because that allows them then, and when they have to relax, there's room to relax. And if they have to tighten further, there's room to tighten. So they're sort of in that perfect medium, perfect middle. And they're always just a little bit that way. Now, the problem with high blood pressure is that they're too tight. And that problem, that is where the problem occurs. Now, if you think about it, let's just sort of get to the essence of what blood pressure is. Blood pressure can be thought of in many ways, but I'm going to describe it as the back pressure against your heart. Your heart's always pushing blood. The blood has to keep circulating. Well, the heart's always pushing against high blood pressure, or I should say blood pressure. There's always a resistance there. So in a sense, if you think of it as this is your V8 engine, you're the engine of your blood vessel system, it's always driving uphill. If it's driving flat or down, you're going into shock. You always have to have blood pressure. So your heart's always pushing against resistance. You're always driving hill. Now, if you think about it, if you're always driving uphill, this engine, the steeper the hill, the shorter the engine life. So if your blood pressure goes up, that's going to wreak havoc on your heart. Now, I don't want you to do this, but if you just got your finger and tapped your forehead, well, let me step back for a second. When your heart beats every day, let's say 60 beats per minute, which is somewhat on the okay, but almost too low side. Over the course of a year, that's a little over 30 million beats a year. Think about that. If it beats 80 times a minute, that's a little over 40 million beats a year. Huge numbers, and that's just in 1 year. So let's go back to that finger thing. Don't do this again, but if you tapped your forehead lightly, okay, after 1 million, it's getting pretty sore. A couple of million, you're hitting bone. 10 million, you're hitting brain. You do anything that many times over, and it's devastating. So if your blood pressure is even just a little bit too high, 30 million, 40 million, 50 million beats a year, year after year after year, it wreaks havoc on your body. Now, the consequences of high blood pressure, of untreated high blood pressure, is devastating. I like to liken it to swimming in Florida with sharks, okay? It's fun in the sun, you feel fine until the shark bites. But if sharks bite, they don't nibble, they really bite. So the consequences of untreated long-term high blood pressure, dementia, stroke, heart attack, pulmonary hypertension, kidney failure, all the big league things, not the little things like my toe is sore. So you don't want to just neglect high blood pressure, even if it's not severely high. Even a little bit over the long term is devastating. Now, people ask me, what is your ideal blood pressure? The answer is interesting. There is no number. People have different blood pressures naturally. But ideally, if I could get my magic wand and lower your blood pressure bit by bit by bit by bit by bit until you became a little lightheaded, ooh, and then backed up a few points above that, that's your perfect blood pressure. Now, I can't do that, and I'm not advocating that. We're not that perfect and that accurate. That's a little too low, a little too dangerous, you might say. But that would be your ideal blood pressure. So we like your blood pressure to be as low as possible without getting in that danger zone. And that's the ideal place where you want to live your life. So that's why we find it so important to treat aggressively. You don't want a C- in the class. You want an A+. We have one life to lead. You want an A+ in your blood pressure. Now, what about our spiritual lives? How often is it that it's not, you notice in blood pressure, it's not the single devastating event that makes you sick over the long term. It's the daily little tiny minuscule too high blood pressures that add up. How often in our spiritual lives do we notice it's the little things in our lives add up over time? Each individual item, it's not that bad, I can do it. Oh, I can get away with this. Oh, that's just the way I am. People can live with that part of my personality. I'm not quite, this habit isn't terrible, but it's, I can just live with it. All those little things, they add up over time, and oftentimes that's really, really harmful to our spiritual life. So don't just try to avoid the big, bad things that we like to avoid in our Christian lives. Avoid the little things. Those things add up just like the big things do. So I hope this has helped you. Let's focus on our spiritual lives like we focus on our blood pressure. Let's get rid of the little things too, me and you. Thank you for listening. I wish you many, many blessings. I hope you enjoyed this video. If you would like to see other such video logs, please go to my website, KeithMcAfee.com. There you'll also learn about my book, Breathe, A Physician's Stories and Reflections on Prayer, published by Westbow Press, a series of 45 true stories from a medical career, and how that relates to our prayer life. Thank you very much for listening. I look forward to talking to you again soon.